Do you ever notice a strange bubble-like bump on your child's neck, tongue, or skin that doesn't go away? Or maybe your baby seems to have a soft, pink or clear lump that slowly grows. These could be signs of Lymphangioma circumscriptum. It's not cancer, and it's not contagious. Think of it like a tiny water balloon under the skin that's filled with clear fluid instead of air. It usually appears at birth or during early childhood. While it might look unusual, it doesn't always cause pain. But if burst, it can leak fluid. So what exactly causes this, and can it be treated? Let's dive into it together. Have you ever seen a garden hose with a kink in it? The water tries to flow, but gets backed up. That's kind of what happens in Lymphangioma circumscriptum. Inside our bodies, we have tiny tubes called lymphatic vessels that carry fluid to help fight infections. In some babies, these tiny tubes don't form properly before birth, kind of like a construction mistake in a plumbing system. That causes some parts to get blocked or swollen, forming small bubbles of trapped fluid. This usually happens by chance, not because of something the parents did. It's not passed down from generation to generation like eye color, and it's not caused by food or injuries during pregnancy. Doctors still study why this happens, but it's mostly a random glitch in development. Imagine your skin suddenly developing tiny blisters that look like frog spawn or clusters of clear pimples, especially on the neck, armpit, or mouth. These blisters might not hurt, but they can ooze a clear or bloody fluid if scratched or bumped. Do you remember when you had a small cut and clear liquid came out? It feels similar. Kids may not even notice it, but parents often do. Sometimes the area feels spongy, or the skin turns red or dark if it bleeds inside. If it's inside the mouth or tongue, swallowing could feel odd. In rare cases, if it grows near the windpipe, breathing might get tricky. But most of the time, it's just a harmless bump, more annoying than dangerous. How do doctors figure out what these strange bumps are? First, they'll ask, when did it appear? Did it change over time? Then they'll take a close look, maybe even gently squeeze it, don't worry, not too hard, to see if clear fluid comes out. But to be sure, they often use painless tools like ultrasound or MRI, like taking a picture inside the body without cutting the skin. Sometimes they take a tiny piece, a biopsy, under local numbing to check under a microscope. Now for treatment, if it's small and not causing trouble, they might just say, let's watch it. But if it's leaking, growing, or in a sensitive spot, options include laser therapy, zapping it gently with light, surgery, cutting out the bubbles, or sclerotherapy, injecting medicine to shrink the vessels. No single fix works for everyone. It's like choosing between scissors, glue, or heat to fix a broken toy, depending on how it's broken. Can you stop a plumbing leak before the house is built? That's the challenge here. Since Lymphangioma circumscriptum happens before a baby is born due to how the lymph system develops, there's no sure way to prevent it. Eating healthy, avoiding smoking, and regular prenatal checkups during pregnancy are always good ideas. But even then, nothing guarantees it won't happen. The best prevention is early awareness. If you're a parent and notice any unusual blister-like spots on your newborn, don't wait, get it checked. The sooner doctors know, the better they can plan. Think of it like spotting a small leak in your roof before the rain causes big damage. Scientists are always trying to find better, less painful ways to treat this. Recently, doctors have started using special dyes with lasers to target only the abnormal vessels, like using GPS to find one house on a long street. There's also new research on medicines that can stop these vessels from growing, similar to how some cancer drugs work, but much gentler. One study showed that a drug called sirolimus, taken as a cream or pill, helped shrink large lymphatic growths without surgery. Another advance is using fusion imaging, where ultrasound and MRI are combined in real time to guide treatment. These tools help doctors see deeper and fix more, with fewer scars. While there's no miracle cure yet, each step brings us closer to treating it easier, safer, and earlier.